Good evening, everyone, and thank you so much for joining us again tonight. Before we get started, I would like to read the brief disclaimer that you see on your screen. And the disclaimer is this: the PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would just like to say hello and welcome once again. My name is Craig Orpello, and I will be your host tonight. Welcome to the PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. The PharmAssist program takes place live every Monday night at 7 p.m. And tonight we will be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. And how is it interactive, you might ask? Well, that's where you come in. You can join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format, either directly into the chat, or you can ask questions through the Q&A section on your Zoom. So we are, as always, joined by amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from them in their clinic. And today we are joined by Wanda Hofgesang. So I want to thank you again for your time and interest this evening. And now I want to turn it over to Wanda. Thank you so much, Wanda, and take it away.
Hi, good evening, Craig. Good evening, everybody. So happy to be here with you this evening. As Craig said, my name is Wanda Hofgesang. I am a reproductive endocrinology nurse. I work in the northern New Jersey area, and I've been a nurse in the field for a long time, over 20, 25 years, I think. So one of the things that has always been a big part of being a reproductive endocrinology nurse is a lot of teaching. Definitely the medications is a big part of fertility cycles. And so a lot of teaching does go along with that. And I've always found it comforting to try to really make what can seem somewhat scary and complicated, try to make it feel a little bit more manageable. And that's where the teaching comes in. And that's where a program like the virtual learning experience here with Mandel's is a wonderful opportunity for us as nurses to be able to highlight our knowledge with the medications, and also to be able to bring it in this format where we can answer questions live with you. So again, thank you for having me, and I'm glad that everybody, hopefully you're here tonight to have some learning. As Craig stated, what we are going to do this evening is we are going to run through 3 products. The first one will be Gonalef Rediject Pen. The second will be progesterone injection, an oil injection. And also, finally, we will also do a Cinera numbing patch. So each of the 3 products, what will happen is we will watch a little video of the product. It'll be a video that I will be showing you how to use that product. And then after, we'll come back live for you to have an opportunity to answer and ask I'll answer questions that you have. Want to keep them to somewhat basic product usage. Anything that might be more specific to you, we will have to refer you, of course, back to your team at your fertility clinic. But just so that you know, we're here to help you with some of the basics with these medications. As Craig said too, just to let you know, if you feel like something isn't here that might be a part of your regimen, just want to let you know that you can always go to mymandelsPharmacy.com /PharmAssist, and you can look up any of the products that might be part of your fertility cycle and see some previously recorded videos that can be very helpful. There's other nurses that are from around the country like myself that are fertility nurses, and so it's really kind of great to see all of us and take a look at those different videos if there's something you need to look at that might not be showcased this evening. With that being said, one of the big things that I always mention before we get started too is just to give you a hint that I think something that's important is organizing your medications before you get started. So what you will find is you might get a rather large box that'll come to you from the pharmacy, and you don't want to feel overwhelmed by opening that box or kind of putting it away. I've had a lot of patients kind of say to me, I just kind of put it all in the fridge and I look at it later. And what I always let them know is don't be frightened by it. Open that box up, because what you want to do is put like items together. because the nurses and your physicians will walk through what you need to take and when. But the more organized you can be prior to all of that, I think it feels very empowering to you as a patient, even though you might not know the medications or quite what you're doing with them or what are they for. And that's where we're here tonight with this learning experience for you guys to see that. But when you're opening up your products, you might not have seen these videos yet. So you just want to be able to organize, put like items together. Okay, so that's one of my big hints before we get started is even if you hadn't opened that box yet, and now tonight's the night, do that. Just open it up, take a look, see how things need to be stored, and then get yourself kind of organized with that. And absolutely, we're here to help with walking you through 3 of the products this evening. So the first one that we're going to get started with is the Gonalef ReadyJect pen. This is an example of what that pen can look like. Mine is a demonstration pen, but just so that you know, this is a pen product, and it usually starts off in the beginning of your cycle. So whether you're doing an insemination cycle or an IVF cycle, Gonalef is a product that usually you're using at the beginning because it's one that's going to get you ready for helping you recruit and develop multiple eggs. So without further ado, I'll let Craig put that video on for us and we can take a look, and then we'll be back here to answer any of the questions you might have. This medication video is to show you how to prepare and inject the Gonalef ReadyJect pen. First thing to let you know is if you are being prescribed the Gonalef pen, mainly you're using that to help stimulate follicles or eggs, multiple follicles and eggs, to grow throughout your cycle. So Gonalef is a stimulation medication, and it contains the hormone of FSH, which is follicle stimulating hormone. So that's the big one that's responsible, whether you're doing an insemination cycle or an IVF cycle. It's helping your body recruit and develop multiple eggs. Once again, I always like to ask or mention first, the supplies that are needed for the Gonalef pen is 1 Gonalef ReadyJect pen and 1 small needle tip that's provided for you with your pen. Your pen will come in a box, a kit of its own, and the needle tips and the pen will be in there as well. Couple little reminders about this medication is this medication is, again, a subcutaneous injection, like some of the different medications for fertility. So it's administered in either the lower belly or the upper top outer thigh area. That's routinely where, I know for me, our clinic, that's where we have our patients injecting. So you always want to follow your clinic and your nurse's instructions, but routinely that medication is administered in that lower belly and those upper outer side thigh area. So that's a subcutaneous shot. It's a little tiny needle. So again, you have an option where you could self-inject this medication or someone could administer it to you. There's no right or wrong. It's whatever works for you that helps you get through your cycle. So don't feel badly if you hear somebody else saying they give their own shots and you're not comfortable. We want you to always be comfortable with what you're doing in your cycle, and for everybody that's different. So whether you'd like to self-inject or have somebody give you your shot, whatever it takes to help you through the process is most important. With your Gonalef pen, it may come from the pharmacy and it may suggest to keep it in the refrigerator. Based on the manufacturer's description with this in terms of keeping it refrigerated, if you keep it refrigerated, it's good until the expiration date. If you keep it outside of the refrigerator, it's good for the expiration date or 3 months, whichever comes first. So either or is fine. Oftentimes we just tell patients to put it in the refrigerator because then that gives you the whole time frame and you don't have to worry about calculating. It's just good until that expiration date. Can I take it out of the fridge before injecting? And the answer to that is absolutely. You can put it on the counter for approximately 15 minutes or so. It just brings it up a little bit from that refrigerator temperature and makes it a little bit easier, a little less feeling that you might notice when you inject that liquid. Typically, this medication will not sting, but you'll feel a little pinch with the needle. And sometimes if that fluid's cool, you might feel that too. So certainly you can put it out on the counter and let it warm up a little bit before you inject. So for your supplies, we have the Gonalef pen. The first thing we do with that is we uncap this pen And the next step is, it is sterile, guys, under there after the first time you use it, but it's just the nurse in me always has the habit of whenever I'm poking a needle into a surface, I clean that surface. So I'm cleaning the surface because I'm going to poke a needle in here. And the needle that I'm going to poke in comes with this product. It is a little needle tip. You just remove the little seal and then gently attach it. Don't over tighten, because you are going to have to take that needle back off when you're done. So you don't want to over tighten too hard. So you just want to tighten it a little bit. And then next step is going to be to follow your clinic's instructions with your dosage. In here, what you will see is there is a little dial and there are some numbers there. Right now it's on 0. What you would do is you would turn to whatever dosage your clinic tells you. So I'm just going to turn this, and by the way, this dial can turn in either direction. So I'm going to turn this dial and I'm just going to simply set it to a dose of 150. So you might be able to see that in there, that it's a dose of 150. Again, that'll be determined by your clinic. The other thing I'll mention with this just quickly is a lot of times patients say, when will I know if it's empty? When you give a dosage after you inject, the dial goes to 0. When that dial goes to 0, that means that you still have medicine in that pen. So put it in the fridge and use it for your next injection. The goal of this pen nicely is that it's already mixed and it's multi-dosed, and you're going to use it up until you're done. Eventually, what may happen is when you turn your dial to your dose and you give an injection, if there is ever a number that is not a 0 in that window after giving the shot, that's letting you know, hey, I couldn't give you that injection because I'm now empty. So you would discard this pen, open up and get a new pen with a new needle, and turn the dial to whatever dose this one stopped at after you finished your injection. So if it stopped at a dosage of 50, then you would open a new pen and give just a 50 unit dosage. The other thing I wanted to mention is the pen is multi-dose. The needles are one-time use. You always only put a needle on, give an injection, and discard that needle into your sharps container that will be given and provided to you by the pharmacy. So the pen itself is multi-use, but not needles. Needles are one-time use, and then you discard, okay? For injection technique for this one, like I said, just to show you that, it will go in either the belly or the upper thigh. So just to get our little mannequin here, in the upper belly, lower belly area, not upper belly because we have some muscle up there, and in our upper thigh, outer thigh area because we have some fatty tissue. So we want to avoid muscle. This is a fatty tissue shot. So if I were giving this mannequin an injection in her belly, I would have her possibly lay down like this, and I would administer the needle to go straight in 90 degree this way, straight in 90 degree this way, or if I'm giving it in the side thigh, it's 90 degree this way. So that would be if she were laying down and I were administering. If she's self-administering and she's standing or sitting, she would be in this position. So what we would want to do to get ready is, the first thing is uncap your pen with the big cap and save it, but turn it so that the part that's open is facing up on the counter. And then you'll see that there is a green color here on the tip. We get rid of that one. Don't try to put that back on. I've watched patients do that and they actually stab themselves, and I don't want you to do that. So that one goes in regular trash. Save the other one. And then what you're going to do is you have to clean that area of the belly so that it's good and clean for this injection. And just a little key with your shots, guys, and I'll show this with my arm, is when you're pinching the skin for a fatty shot, you want to give a gentle lift. If you squeeze really hard, you're going to bruise. So sometimes when patients come to me with bruising, I actually have them lift gently so that make sure that they're not squeezing so hard. It's just we're kind of nervous, so we squeeze a little harder, and then that can cause trauma to the skin. So it's this one, it's a gentle little squeeze. Again, we do not have to jab this needle. Just place it to the skin, give a little push. That needle goes all the way in. Once that needle's in, then you are going to push on the end of this pen and push all the way until you feel almost the pressure that you can't push anymore. And once you feel that, count to 1, 2, 3 and let go. Then remove the needle in the same angle that it went in, set it down, and put a little cotton ball to that area. Wipe it if you need to. Usually you do not need to Band-Aid these areas because literally the bleeding stops very quickly. And you'll be able to touch the area after you've given the shot because you won't have felt anything other than the pinch of the needle, which is like a mosquito bite, and usually you will not feel the medication going in. Now what I do is I take a look at that dial, and I do have a 0 in my window there. So that tells me that this pen has more medication. So what I'm going to do is I take the cap and I put that needle into that cap and I give it a little pinch and I twist that dirty needle off that I used. I discard it into a sharps container that I will have from the pharmacy, and I reattach the pen cap, and the pen goes back into that refrigerator for your next use. So keep in mind, this medication is subcutaneous, meaning it's a little fatty shot in those thigh or belly. It contains FSH, which is the follicle stimulating hormone, which helps your body recruit and develop those multiple eggs, whether it be that you're doing this for insemination or for IVF. Hope this helped you with your Gonal-f, and best of luck with that medication. So everybody, we're back with a chance to ask some questions. But first, what I do want to say about that is I do hope that video showed that the nice thing about a product like this is the benefit of it being in a multi-dosed 1 unit, nothing that you have to mix. This product has come a long way. As I said, I've been in the field for a very long time. And what I would want you to know is that it really is so much more simplified. I do understand, and I'm not underestimating that it's an injection, but by all means, it has come a long way. It used to be something that you would have to mix, and it was in little glass ampules, and that could become a little tricky with trying to break open a little glass ampule. And I can certainly remember teaching that to the patients. So I really, I feel as though for patients, we have really simplified this product nicely, keeping it in a 1 unit delivery system. And, yes, you're still doing the injection, but even that has changed somewhat too. There were times when some of these injections were intramuscular, all of them, and now they are with a much smaller needle, which is nice that, also that has changed along the way as well. So that's just my little extra hints about that, even though some of you don't know what this looked like years ago, but it really, really is a much, much simplified product than it used to be. So Craig, if we do have any questions out there.
How's it going? All right,
It's
perfect.
going.
So we do have some questions, and just a quick reminder, if you are joining us in Facebook, you can type directly into the Facebook chat. And if you are joining us via Zoom, you can type it either in the chat, or you can also put your questions into Q&A, just like this question that came in. So, okay, so we get these a lot, and these are the ones where people are kind of already anticipating potentially issues. And that's a big part of why we do this program, right? Is so that you can get all of your potential theoretical failures out of the way now, so that when it actually comes, you nail it and you don't have any problems at all. So this first question is, what happens if I missed yesterday's shot? Should I double up on today's shot? Do I just ignore it? Do I call the clinic, etc.? I just don't want to make a mistake.
That's a great question, and that does get asked a lot of us sometimes. Everybody's a little worried, concerned if they make a mistake, and sometimes some people get a little afraid to own up to a mistake. And what I would want you to know is that what might be perceived as a very big mistake on your part might be something that we can readily take a peek at and really help calm your any worry about that. So the first thing is absolutely tell your clinic, your primary nurse, and your team, because sometimes there might not be a need to, even if you missed an injection, there might not be a need to double up on anything. Oftentimes in our clinics, we are watching you pretty frequently, as I'm sure some of you will see this, or if you've done maybe cycles before, but this is a new medication that's being added. You might have that experience where you've been seen frequently in the clinic. So just to let you know that, it's always important to talk to your clinic team, letting them know, and then they will make adjustments if they need to. On occasion, sometimes, the doctor and the nurse team might tell you to increase a dosage. They might tell you to leave it alone, or stay on the same dosage. It's not like you have to make up for it. But I think the key to that, or the key answer I would say, is don't worry and hide behind what is a perceived mistake on your part. Let us know so that we can then address with a solution for you.
Perfect. That's a great answer. And you'll probably hear that come up more as we do these programs and as we talk through tonight at home. If you're listening, that a lot of it is the everyone working together, the patient, the clinic, and the pharmacy. And so to always feel comfortable reaching out when you have questions. And a lot of times we'll try to answer tonight what we can, but sometimes we'll direct you back to reaching out to your clinic. And so it's a good as time as any to point out that that's the perfect time to reach out to your clinic, is when you think something went wrong and you want to figure out how they can plan for it, because it's not the first time. All right. So let's see, another question that comes in here that says, very basic, just when you walked through how to give the shot, the question is just confirming, is self-administration also at a 90-degree angle?
Yeah, pretty much it would be. There wouldn't be a change in that injection necessarily when it goes in. You got to remember, these are smaller needles and they are going into the fatty tissue. So the best way to just make sure that it's gone completely into that fatty tissue is to keep that at that nice straight in angle. Sometimes if you angle it a little bit too severe, that's not straight in, you might be staying just in the dermal layer, and that's not where we are when we're giving these injections. These are subcutaneous, which means they are in the layer of the fatty tissue. So the needle itself will get you there, the size of it, but the idea is that it's best if you're then placing that needle in so you can get it right into that fatty tissue.
Perfect. All right. Thank you very much. Let's see, going through, we have some other questions coming in. Okay, so this one is, do I have to leave the needle in my skin once I give the injection, or can I just pull it out as soon as I'm done? I've seen both done, and I just want to make sure that I'm doing it correctly.
Good. Again, another good question. And my way of showing that to someone has been when I did a lot of in-person injection training, and I'll still do many one-on-ones with patients that need assistance, is I will show them outside of the body when I press on that plunger, especially with the Gonalef pen, and that's how you're administering and releasing the liquid into the body, is that even when you've pushed it all the way down, there's still a couple droplets that are still coming out. So if you were to just push down and then pull it out, you might lose those little extra droplets. And so I think that what you want to know is you want to get every last little bit of that injection and that dosage. So a little technique or a little trick that I'm always showing when I show this pen product is that when you press down on the plunger and then it can't go any further, do a little 1, 2, 3. Then release the needle from the body. I just find that I do that even when this is outside the body, and when I finish by 1, 2, 3, it usually will have stopped dripping. So I have demo pens that I can show this to the patients in person, and that allows me to kind of make that point that if I press down and if I were to release, it would still be dripping. So I show them to press down, let it go in, and then do 1, 2, 3, and by the end of that, it's ready to be removed. So I think it's just good to wait a couple little 3 seconds, and then you can remove it from the skin, just so that you get the benefit of each and every little drop from that pen.
Definitely, if you're paying for it, right, you might as well use it.
Absolutely.
You don't want to have it wasted. So that's a great point, and I think it's always good. Yeah, exactly. All of this is liquid gold, so we want to make sure that you're getting the best utilization out of the medication that you're getting access to. So great answer, excellent question. Thank you very much. Okay, so here's another injection question, and it says, some of my injection sites are starting to get hard to the touch. I've skipped those sites in my rotation, but is there anything that I can do to make it go away?
Maybe just what I would suggest is pay a visit into your clinic, just to have them take a look at it, just to see what it is in that regard, because usually with your little injections that you're taking, oftentimes you shouldn't have a lot of localized effects to them that's left over. So what I want you to know about that is that you shouldn't really see that usually with that product, but sometimes that could be somebody's symptom. So anybody could have a little localized reaction, which could be some redness, a little itching, it could be a little raised area. But if you're moving the injection around, that is the key. Sometimes it's just going to be the passage of time, but I would want you to go in if there's ever an area that doesn't seem to be healing. I would always encourage you to go into your clinic with that. This way here, the nurse can take a look at that. She can document that, and then she can talk to your primary physician and see if there is any need to take a look at stopping the medication. Is it somewhat of a reaction for you, and changing to something else? So there are a lot of alternatives. It's never like we would want you to feel like, oh my gosh, if I can't take that, I have to stop my cycle completely. So rather than, not know the answer and worry, I would always say, seek out your clinic when you go in. And there's oftentimes nurses there that can see you in the mornings when you're going in for your monitoring. But with any injection, you could get some sort of little local reaction, but often we want to just address it if it's something that doesn't seem to be going away. And we would have to look at it individually to really give you a answer to what you might need to do. It can't be what somebody else has told you to do. You want to make sure you talk to the clinic and make sure they see what's going on.
I did mention that you would hear the theme, that we might direct you back to your clinic a couple more times tonight, and there we go. Perfect timing. So
Yep.
great way to bring all of this program together, which really is to help answer those questions that you are thinking about beforehand, so you don't have to deal with them by the time that actual shot comes, and to really direct you to the best place to get those answers as well. So great questions so far. It looks like we are all caught up with questions from the GonerLeft pen. So it's a perfect time for me to remind everybody, don't worry about it if you don't get a question in time. We will certainly get to answer any questions throughout the program about any of the products we're talking about tonight, or any just generalized fertility medication questions you may have. But we will give another 30 seconds or a minute or so, as always, just in case somebody is in the process of typing a question right now. So I will turn it back over to you, Wanda, if there's anything you just want to wrap up with before we get ready to move on to the second product tonight.
Okie doke. So the GonerLeft medication, just in terms of when you're organizing that, you might have that one in the fridge when you open that up from your box. But the other thing, just to let you know, is you will usually start a cycle with this. So this will be one of the ones that begins early on in the cycle. One of the things I would just want to emphasize is that in that box, you will have maybe several different medications, some of which you might take simultaneously, but you're never on all of those medications all at the same time. So the great part about organizing what's in the box from the get-go, even if it's just separating the like items, is then you can address with the help of your clinic, and with, if you ever have a question from the pharmacy about something that was received, we would always want you to know that we collaborate with our pharmacies to be able to work with the experts there, such as the PharmAssist, et cetera. So if there's ever a question after you open your box from the pharmacy and you're just not sure about something, by all means, you can even call the pharmacy. They are also a resource to you because they are the ones that are sending you the product. So they, like us, can help you with any questions. But with that GonerLeft, this will be something that you're taking pretty much in the beginning of the cycle, just so that you do know that. So this would start out a cycle, okay? One of the next medications that we're going to talk about that we'll go and show and see a teaching video on is a medication called progesterone. And what you will see that's different about progesterone is progesterone will maybe come to you in a box that's going to say on it progesterone injection. And in there, what you will have is a vial of medication, or a vial of the medication versus a pen. So there is no pen here. This is more of a vial to kind of compare the two with the GonerLeft. And the other thing about your progesterone injection is that it is already mixed in the vial. So it's in liquid form. So it's similar to GonerLeft being ready to inject. Two things that are different, though, is being not a pen, you're going to be drawing up dosages from this bottle. So you'll be drawing up multiple dosages. So it is a multi-dosed vial, kind of like a multi-dosed pen, but the delivery systems are a little bit different. And this medication, what you'll see is that it's a little different technique. It's now going to be that you use the intramuscular area of the buttocks for this. So with progesterone, what I just want you to kind of think, with the GonerLeft being shown first, this is a little bit at the beginning of a cycle, and the progesterone is oftentimes more towards the end of a cycle. It's preparing the body for implantation. So it's preparing for successful pregnancy with implantation. A lot of times people are very nervous to hear about having to take this medication. So I just want to mention that don't be nervous, because there is a beginning date of starting it and there is an ending date. It is not like this is a forever, I'm going to be on this forever. Okay, there is a beginning and an end to your progesterone. It's just that it starts a little bit towards the end as you are going to get closer to the outcome of pregnancy. And then for a lot of the shot, you're going to be pregnant. So a lot of people at that point, they're so excited about their pregnancy that they're not so much worried about as much about the progesterone as much. So that's a good thing. That's a good thing to look forward to. So I think what we'll do is we'll let you see that video of the progesterone, and then we'll come back here if you have any questions about that, so we can review that, anything that you might have that's about that technique and that medication. This medication video is to show you how to properly mix and draw up and inject a progesterone injection. With progesterone, why am I taking that? Probably is the biggest thing that we get asked first in the fertility clinics. And with progesterone, what you want to know is that's a key medication to helping the lining of the uterus be well supported and nourished while an embryo is looking to attach an implant for successful implantation. So medications that help that, progesterone being one of them, is used in your fertility cycle, and it's used to help in and around that embryo transfer, so that your body has everything it needs in hopeful implantation for successful pregnancy. So that's the first thing you want to know about progesterone. The other thing to know is progesterone is administered into the buttock muscle. The reason sometimes with this medication that we often have patients ask about other areas, though, I was going to say, is that, you know, we use the buttock muscle because it's a big non-weight bearing muscle. I think I do get asked a lot, can I use my quadriceps? Your quadriceps, and I'm standing here marching in place, if I had to lift up legs that were getting progesterone shots, it might be a little difficult to do that. So the idea is that you want it in a nice muscle that's great for absorption, but doesn't have weight bearing on it. And that's what those quadricep muscles have, is that they have to lift the leg. The other thing is the deltoid muscles, where we might get flu shots. Not a great muscle to use for a progesterone shot, simply because it's just too much for these little muscles to handle. And again, these hands and arms have to be raised up, and then you're using that muscle to do that, lifting, grabbing something, and it would just be way too much. So just to confirm that the location is always going to be the gluteal muscle. And the nurses at most of the clinics, even like ours, we definitely, what we do is we try to do our best to help give you a circle on both sides of the buttock, the left and right. Because the thing to know about progesterone is usually you are on it for several days, sometimes it even can be a couple weeks. And the reason for that is in early pregnancy, it's what's helping keep that lining well supported, again, where that pregnancy is growing, until we have a placenta that takes over, which is the mom-baby connection. So that's its key importance, and why you might be on it a little longer than some of the other ones is because that little phase takes a little while for that placenta to fully function. So the progesterone in oil is an injection that it's intramuscular in the buttock. It is used to help support the lining for hopeful pregnancy and nourish and give everything that that embryo could need to have a successful implantation. And it is also something that typically we would recommend that you have somebody administer to you. I'm not going to say I haven't ever helped somebody who had to do their own injection, but when it comes to muscle shots, if you have somebody that can inject and give you the shot, it just takes a little bit of that pressure off. The one thing I will mention is sometimes patients want little hints or help with this shot because they might have heard things about it. First thing I would say, as far as storage goes, it's really important that your vials of progesterone do not get refrigerated. So one of the things I will mention about that is when you get that nice big box from your pharmacy, possibly Mandel's, don't be afraid of it. Okay, guys, you have to open that box because human hands packed it. So you want to take that packing slip out and you want to just look to see quantity of what they've sent. That's really what a packing slip is, just like if we ordered something from Amazon. So what you want to know is it's really a good idea to open up that box, take a peek at it, see that you've got everything that it says has been sent to you. And hold off, you don't have to look through everything right away. But one of the things that I would say, particularly with progesterone, is that typically it's in an oil base. So oftentimes it's very important that it just maintains at a room temperature. So feel free to contact us if you have any other further questions, and contact your pharmacy when you do receive this medication. But definitely get it out of the box and leave it on that counter, or leave it in a safe shelf where nobody will get at it. One of the other things I'll just mention is at our clinic, we're okay with letting you use the old tried and true, a little bit of ice to the area. And you're not over icing when you administer for this. You're just going to give a little ice to the area before the injection, and that helps just numb it so that you don't feel any pinch of the needle going in. So ice everybody has available to them at their home. So just know that that's one of the things that I will talk about again, but just to let you know that you can use prior to administering in that glute muscle, is to apply a little bit of ice. And we'll also talk about another product that I'll be just showing you here, is just to let you know that there are Cinera patches, which are also helpful sometimes for people that sometimes have difficulty with getting blood drawn, and they've got a lot of anticipation based on that. It is a numbing type of cream patch that you put on to the area. So we'll talk about that later, but I just want to let you know there's some other options that you can talk to your clinic and to your nurse about in case you're having troubles with those injections. So with the progesterone, the next thing that we need to know are the supplies. And so once again, our little list here is for progesterone, we need 1 vial of progesterone in oil, and oftentimes it might come in a box that'll say right on there, progesterone. You will need 1 3cc milliliter syringe, and there may be definitely a needle attached to that. So keep that handy. You'll need that 1 syringe, and that needle that's usually attached is this 122 gauge inch injection needle. That's usually what is already attached to that. If your syringe comes separately without a needle attached, you would need the 3cc 3 ml syringe, and separately a little package of a 22 gauge 1.5 inch or 1 inch needle. Most often, most of us need a 1.5 inch needle, but there are times that some patients are rather petite, and we can order a little bit smaller needle for them that'll still get into their muscle. But most of us technically need that 1.5 inch to get to muscle. And then 1 18 gauge pink needle. It's usually pink in color, a little pink on the label here. It might be hard to see that in color, but just to let you know, it's a pink needle. I want you to know that that is a big needle that looks like a nail. Never, ever, ever would we ever want you to have to do that as an injection needle. So just know, if you see that when you open that box from your pharmacy, please do not panic. That pink needle is simply to help draw up the medication. And it makes it a lot easier when something's thicker in that vial, a little bit thicker oil substance, helping you draw it up from that vial is really easier with the pink needle. But then you discard that pink needle. Never, never, never do you need to have an injection with that. You just don't want to put that into the muscle, okay? So always, always, always ask if you're ever concerned and you just saw that needle and you forgot, what the heck is that for? And you're panicking that has to be administered into your muscle. It does not. So it goes into the bottle only. So with all of our medications, as I mentioned, it is not a sterile technique to mix or administer medications, but it's always a clean one. So what you want to do is have nice clean hands after you get your supply. So you can clean with soap and water, or you can take a little bit of hand sanitizer and sanitize your hands before you are going to work with that medication and prepare it for injection. So with our bottle of progesterone, there'll be a plastic cap that we snap off. Okay, under there, what you want to know is it usually is sterile after you open it the first time, but this is what we call a multi-dose vial. You are going to use the contents of this vial potentially until it's empty. So because of that, each and every time you want to clean the top with a little alcohol. And if you get these little prep pads, you can use them. The other thing I would say to that is, if you don't have prep pads, a regular bottle of alcohol, isopropyl alcohol with cotton balls will do. So you don't have to have these little prep pads. If you don't, it's okay. But most of the pharmacies, and I know the pharmacy Mandel's, they do supply this to their customers. So I just want you to know that they will probably be in there for you to utilize. Once you clean the top off, the next step is to take the needle and syringe that may be coming together, or if it's just a syringe, whichever, you need just the syringe to start. So what I always do is, this is in a little sterile package, and when you open it up, you can hold your hand on the needle, pull back the packaging, and just twist off the syringe. And you can leave that needle in there safely. That's our injection needle, so we'll leave it in there until we're ready for it. And then what we're going to do is we're going to take the pink needle, open it up from its package, and we're going to twist that gently on to the syringe. Don't over tighten, because remember, we're going to remove that needle, so we don't want to have it where we can't get it off. So you want to gently tighten it, and that big pink needle is what we're ready to go, and it draw up a dose of medication that we need to administer. Typically what I'll show you is a typical dose is 50 milligrams, which in terms of a liquid amount is a milliliter, 1 milliliter, or 1 cubic centimeter. So a cc and an ml is the same. That's the other thing, that a lot of us nurses have different lingo with that. So some nurses will say take 1 cc, and the patient may have been hearing from another nurse that said 1 ml. So a milliliter is equivalent to a cubic centimeter. So 1 cc is equivalent to 1 ml. Probably a good side note to know that, because we all do have our own little lingo, and I don't want that to throw you off. So I'm going to draw up some air. And the reason I always just do that is because there always can be a little pressure in the vial. So however much liquid you're going to take from that vial, you inject that much air. So you draw down and line up the rim of that plunger to that number 1. If you're doing a dosage of 1 ml, 1 cc, if you're doing anything more than that, your clinic is going to let you know that. So you'll always be following your directions of your clinic. And then what we do is we insert that needle straight into that vial. We push up on the bottle and inject a little bit of that air, and then we draw down and fill up to the 1 ml. With this one, you don't often find that you'll have bubbles, because it's not a water base. Being an oil base, there might be a little less bubbles in there. So sometimes you might hear about air and having to flick out any air. Not typical that you're going to have to do that with this medication. Okay, so you can remove the needle. The bottle, you will use it again until this bottle's empty. So remember, multi-dose bottle, put it away. When you need it for the next injection, when you take it out, you clean the top off. You don't have to cover the top, but you're always going to clean with alcohol before you poke a needle through it. Okay, so multi-dose vials are good, because you don't have to use many different items and supplies. You want to then safely cap this needle. The pink needle is going to come off, and then I'm going to discard that in my sharps container. You'll have a red sharps container from your pharmacy typically, to keep safe all of your needle tips and all of your syringes. And then what we're going to do is take the injection needle and now twist that on gently to get ready to administer. So now we have our medication and our injection needle ready to go. A little hint, some people do, I've taught this many years, so it's no right or wrong, just some little tips you could do. If you'd like to, you can roll this syringe in your hand. Because it's an oil base, sometimes people hear that, what can I do to kind of help with that injection when it goes into the muscle? And what can I do to help it absorb or break down into the muscle? So because this is a little bit of a thicker solution, you know, certainly that's the reason why it takes a little bit longer to have it break down. So one of the little tricks could be this rolling, because just the friction and the heat from your hand can do that. I know some clinics might even actually recommend that you could take your tap water, run warm tap water, and the needle's covered that's sterile, and you can run it over a little bit of warm tap water to just, again, once again, do what you can to sort of, it's to make it a little less thick when you go to give that injection. Okay, so those are just some little tips that you can try to see if they help you, and I hope that they can, with this injection, help you. The other thing that is a little tip that I know we do at our clinic is, I'll just get my mannequin. This is an injection that's going to go now into the muscle area. Pardon me, she's losing her undies or underwear. This is, the side here is open to show that the red is the muscle. That's why we need a longer needle, because we need to get into that muscle. And all of us have a little pinching of fat. So the yellow is fatty tissue, the red is the muscle, and that's the sciatic nerve. But the nice thing is when your clinics and the nurses there are marking you, which a lot of times all the clinics do that, they are marking the appropriate area that you're going to need in your gluteus muscle. So what you want to know is we're marking what's called the upper outer quadrant of the buttocks to administer that shot. So you don't even have to worry about that sciatic nerve, because you know where we're usually marking you is going to be free and clear of any of that. Keep in mind that when you get this injection, the administration of the needle is something that we'll talk about. You might feel a little pinch if you don't ice the area, or if you don't use one of the Sanera patches, which helps to sort of numb it. If you don't do either of those, then you would feel a pinch with the needle. You might feel a little bit of pressure when the fluid goes in, but it's very fleeting because you're not putting in a lot of fluid or a lot of medication. Really with muscle shots, it's the next day. And any of us that have had flu shots or anything, vaccines in our arms at times, you know that your arm feels a little heavy or a little just tired. Or when you work out at the gym and your glutes are a little sore, that's really what you should potentially feel after a muscle shot. There should never be redness, warm to touch, itching, swelling, severe pain. And if there is, always contact your center and speak to your center's, your nurse and or your team, because they would want to know about that. Because we don't want you to feel as though that is a normal symptom that we should feel after we administer these shots. A little soreness, and you should be able to rub at the glute with your hand, but anything more than that, definitely that's something that you can report to your nurse in your clinic. The other little thing that I'll mention about after the injection that's a good idea is gentle massage. Some people even use the foam rollers from their exercising to sort of roll over the area a little bit. If you have a handheld massager that's got some heat, that's great. A little bit of warm, moist heat. These are all things that are just comforting to the muscle, and it just helps. So what you'll find with this injection when we do have to administer is the nurses will hopefully have helped you with where to give it and have circled that area. And usually we put circles on both sides, and we do it in Sharpie pen, and you can retrace it because it'll fade a little bit in the shower, but it usually doesn't ever go fully away unless you really are rubbing at it to, you know, with soapy water and such. So it'll fade a little bit, but you can retrace. And you want to move the injection around each evening to a different side. You would want to alternate right, left, left, right, and within that circle, moving the injection around, just so that it gets to all of the muscle and it's not so difficult that it's having a difficult time breaking down, okay? With this medication, as I mentioned, it is intramuscular in this glute, so it is recommended if somebody could administer the shot to you. If you want to, you could stand for the injection. If you stand for the injection, if somebody was administering into my right glute, what I would do is I would stand and put all my weight on the left side, and I would just lightly touch down my right leg. What I'm trying to accomplish with that, if I stand, is I want a relaxed muscle. So that's one way you can do it if you'd like to stand. If you don't want to stand, then what you could do, if I were administering and this was a real person here that I would be administrating, her front of her body would be facing you, and the back here where I need to administer is facing me, and I would administer. She's laying down, so her muscle is already relaxed. So key thing with progesterone shot is a nice relaxed muscle, so that just it's nice and easy going in. And again, if you're using a Sanera patch or a little ice, if you do any icing, we always do recommend, though, do not over ice. There's no reason for that. You could just do a couple minutes on your timer on your phone, and that'll numb the surface so that you don't feel the pinch. A little bit of the soreness that you feel, what helps with that really is warm, moist heat, gentle massage, even, like I said, walking around, activating that muscle, but you'll feel it a little bit, but it's not excruciating, and it should never be that you can't sit, walk, sleep, etc. It should never interfere with daily activity. That's important. And if it is, then please notify your clinic's nurse team, okay? So if I'm ready to do my progesterone shot and I have the area and I've iced it already and I'm giving this to someone, I'm going to take my cotton ball with alcohol and I'm going to clean that whole little area. My next step is going to be to uncap my needle. I know this looks a little scary, what I want to say to you is literally the little tip is what's sharp. We don't really, when we're given a shot, we don't sense how deep it is. We sense when it went in. So if that helps you to kind of understand that, I understand completely by looking at the size of the needle, but I want to help to relay that it's the tip when it goes in will feel like a pinch, like when you get your blood drawn, okay? With this one, we do not need to pinch and gather the skin. We actually are going to keep our hands away from that area so we don't get hit, but you could open up, do a little L with your hand and wrap it around. Remember, I would be behind this person if they were standing, and if she's laying down, I would have her on her side and I could be sitting. But in this little video here, I kind of have the angle of this needle going in at roughly a 45-degree angle. The needle going into the body in my hand is in a 45-degree angle. It is not pointed, the needle down to the floor, and it's not parallel to the floor. It's roughly 45-degree. No jabbing. That's not necessary to trauma the skin. Place the needle to the skin and give it a little gentle push. The needle goes all the way in, because that's a question I always get asked, and it needs to go in to get into the muscle. What you then do is take your hand that was wrapped around the hip and hold that needle in place, and you're going to pull back gently on the plunger. When you pull back gently, what you're looking to not see is any blood enter the syringe. And I want to let you know that it's very rare to happen. I think in my 26 nursing year career, I've maybe hit once or twice where I gave a shot and it even hit a vessel or a little vein. It's okay. If it does go in and you notice it and the blood enters here, not a problem. You haven't injected anything yet. However, what you want to do is remove the needle. What we have you do is remove the needle completely, change the needle tip. You can use the medication because it's going into the same person, and go to the other side and reattempt to administer. It'd be highly unlikely to have that happen a second time, okay, just to reassure you of that. But if you pull back and you do see blood, just stop, think of a stop sign, remove the needle completely. You'd put a little cotton ball there, put a little Band-Aid if you need to, and then go to the other side, but change the needle tip, because the needle only goes into the body once and comes out once. It doesn't go back and forth and in several times. So when you pull back, what you're mostly going to see is nothing. There's no change in the color of this liquid, because oftentimes you're in that good spot that's been marked for you. And then you just gently push, and it's going to take a few seconds with the progesterone because it's a little bit thicker, but you push it all the way in. You can do a little 1, 2, 3. And then you remove the needle in the same angle as you inserted it, gently from the skin. You remove it, set it down. Don't panic if you see a little oil coming out or a little blood. Put pressure and hold that cotton ball there for 10 seconds. Here's where some people like to put Band-Aids on, some other people don't. All I will say about Band-Aids is don't leave them on in the morning all day until you do your next shot the next day or anything like that, because you will get rashes from some of those Band-Aids even if you don't have a latex allergy. So put the Band-Aid on if you're getting dressed and you just don't want to soil your clothing, but at some point take it off, kind of like we do with our arm. We don't walk around with that, you know, gauze and Band-Aid there. It's just there to pressure to help that bleeding stop, but this is not even going in a vein. This is going in muscle, so it'll stop pretty quickly, okay? And then remember, with progesterone, that you can find out from your clinic what they would like you to do, if they would like to add in a Sonera patch that we'll be talking about at some point on the videos here, or just want you to use a little bit of ice. But post-injection, the key to that is just a little moist heat, a little warmth, a little gentle massage. But the ice really can help with the pinch. And the nurses marking the area, I think, gives you a lot more confidence in knowing where it is that you need to go. Okay? So remember this. This is a shot that when you're taking this for several weeks, you have a nice pregnancy. So the whole goal of your fertility cycle is now manifesting, and when you're doing those injections, a lot of people don't want to get off the shots because they're concerned about doing that for their pregnancy, but you don't have to worry. When you come off those shots, it's a nice reprieve, but you've been doing them and you have a good reason to be doing them. So best of luck with you. I hope these tips help you with the mixing and the administration of progesterone. So back here we are to see if you have any questions in a little bit, but you saw there's a lot going on there with progesterone. Not so much, thank goodness, with any mixing, but just drawing up, and a lot of good tips that we tried to provide with that video. And a lot of the tips that I provided in that video is because it's a lot of the questions that I get asked. So trying to help you with, you know, do I stand up? Do I sit down? Do I, somebody have to give me the shot? How do I, ways of preparing the skin? How do I prepare the skin? What's it going to feel like? So I really do hope that that video gave you an awful lot there to see, and feel free to, you know, watch it again if you have to. But I'm sure we have some questions here about the progesterone, and maybe we can add to the content that was given to you through that video through any of the live questions that you might have.
Yes, there are definitely a couple questions coming in already, and we typically expect that with progesterone and oil, just because there is a lot going on. And this first one is just kind of, I guess, getting a basic underlying understanding of what the progesterone and oil is, right? You talked about why we're using it, but the question comes in that says, what's the difference between the progesterone and oil and other things I've heard about, like progesterone pills or suppositories?
All of the progesterone products are supporting what we call the luteal phase. So once a woman ovulates, so if she ovulates and she has an intrauterine insemination, or if she ovulates naturally, or if in the IVF you ovulate and then you have an egg retrieval to remove the eggs and put the eggs with sperm cells to develop an embryo, and then you have an embryo put in. After that ovulation, it's your luteal phase. And progesterone is a key hormone that we do secrete naturally to help prepare the lining of the uterus for preparing that environment to receive the embryo and allow it to attach and grow and develop within that uterine wall, within that uterine cavity, the endometrium. So what you want to know about progesterone is that whether it's a shot, whether it's a suppository, whether it's a tablet, yes, there are many forms of progesterone. We at our clinic use all the different forms as well. This is just one of the varieties oftentimes that at a lot of clinics you might see this being used, if particularly you're doing a frozen embryo transfer cycle, or a an IVF cycle where you're having a fresh embryo put back into the body. The feeling is that, you know, a lot of clinics like to use this one because they feel like they can measure it in your blood and they can see what's being absorbed, etc. Sometimes when you're not doing the intramuscular and you're doing it via pills and suppositories, we know it's a little bit trickier for us to measure that in your blood, but we do know that those, through many, many studies, we do know that those varieties work as well. So basically, in a nutshell, it just is a matter of, for your age, diagnosis, and history, and what's going on with what type of cycle you're using in your clinic. You can definitely be exposed to different varieties of progesterone for sure, but each and every one of them is supporting that luteal phase, which is that part of our cycle where once we've had our procedures or our ovulation, we are then waiting for our bodies to receive that embryo and allow it for successful implantation, and in hopes of then having the positive pregnancy test, which is the end result of any and all of these cycles.
Perfect. Thank you. That's a really good answer to a potentially complicated question, but really, you know, to understand why progesterone in general is so important. I think that all that information is very helpful for that as well. So thank you for that excellent question and for such a great breakdown there, Wanda, as well. So now we kind of venture a little bit away from some of the different presentations of the medication and talk about some of the potential mistakes people are worried about. And we know this always happens. There's always a couple questions like this when we talk about progesterone and oil. And the question is, I'm nervous that I might inject it into the wrong site area, no matter how much you showed in the video today. Any more hints on how to remember where I can do it? And most importantly, will I know if I've put it in the wrong spot?
Good question. I will just mention that, as I stated in my video for our clinic, and I've worked at other clinics too, so I know that other clinics often will try to do this. We do try to mark when we know as a patient might be getting closer to starting this, we try to physically mark on you the areas So I think that is a big help, and you can always ask for that. I know we see it. I'm an early morning nurse with patients, so I tend to do that very frequently because I will be seeing patients during their morning monitoring when they're coming in. And if they want, they know they're going to start this shot today or tomorrow. I put it in there with a little Sharpie, and I tell them, unless they scrub at it, it'll go away. But I guess another helpful hint is sometimes if you're holding where your hip bones are and in the front of the body with your fingers like this, holding those hip bones, and then you wrap around your thumb to the back, really where that thumb tends to hit is in that area. It's, not a specific, very little tiny spot. It's not like you have to hit a pinhead of an area. It's a pretty good sized area in diameter. So very rarely is there an issue with people giving it in the wrong spot. But sometimes if someone does develop something like some redness, some warmth, some like a little hardness to touch, that's when I do say come in and see us, because we might be that you might have migrated a little bit with your spots. It doesn't mean it's not being absorbed. It's just that muscle breaks down that medication a little faster than your fatty tissue would. And a little bit of it in all of us can get in the fatty tissue, but it just might take a little bit longer for it to break down. So that's where it might sit a little bit, and you might have a little lump there. So the idea is that sometimes somebody may have moved around a little bit from the circles, their original circles. So you can always get it remarked. But the idea that I would say is, if how would I know, is if you have some redness, some pain to touch, some warm area or a hardness, you can always go in and see the clinic and see if they can take a look at it, because they would want to double check it for you. And if they needed to readjust, I'm readjusting a lot of times with ladies, remarking, even ladies that got the initial shot, the initial marks. I will always, be readjusting those shots if need be, because sometimes they have a little painful area that developed, or to them it's a sore area, and I want to let them know that they've still got other area that they can use, because I think everybody sort of thinks it's a very small space when it's got a lot of space there for that injection.
Great, thank you. Yeah, I think it's sometimes, I think in people's minds, that the perfect way you put it was that they think it's this like very specific little spot that you have to hit, this like, this microscopic, if you miss on either side, it's gonna, it's gonna be terrible. And it's not, that's not the case. And so hopefully you can learn a lot of that tonight at the program as we talked about it. You also have your office that you can reach out to and speak with your nurse and have them redraw the circle or anything like that. But I definitely think this is a great way to at least put people's minds at ease that it's not this very, very difficult, Robin Hood type archery that you're trying to land. It's a lot easier than that. So great answer. Thank you. I'm sure a lot of people's minds, you just took a lot off their shoulders right there. So let's see about this next question coming in. It says, a friend of mine had an allergic reaction to the oil in the progesterone and oil. Is there any way to know if that will happen to me beforehand? Are there any alternatives I can take in case I do have the issue?
Good question. One thing that you'll note oftentimes is that if we know that there's a particular allergy that you might have, and some people do, we have to know those allergies, especially when we're bringing you into an OR sometimes to do a procedure for like an egg retrieval. They know your allergies. So if you share anything that you have an allergy to, we will share that if we need to as well with the pharmacy. And they often will work, the pharmacist will work with the pharmacies like Mandel's, will work with us to make a recommendation of what might be best for you if indeed you happen to have an allergy. So believe it or not, we are working very closely with the pharmacy and the pharmacists at times with patients that might have even had a previous exposure to a medication, and then like a progesterone shot, and then they had some sort of rash or issue that we addressed by then putting that medication into a different compounding base. So just know, again, you don't want to worry like, oh, I can't do my cycle because I have an allergy or I had a reaction to that progesterone. We will find then the alternative that is going to work for your body, which that's why in this case, patients are definitely treated individually, because some people may not be able to tolerate it in a specific type of oil base, and we might have to use another type of base product base for that progesterone. as a way to compound that product. So just know that, yeah, this is where, again, a lot of collaboration between you letting us know your allergies, us letting pharmacies know your allergies, and pharmacists working with us with their expertise on what might be best for our patients. We rely heavily on that.
Perfect. Yeah, that you nailed the idea of the trinity that we talk about, the patient, the clinic, and the pharmacy all working together. It's a big part of what PharmAssist is to be able to provide that connectivity between all three of us. And we will continue to work that way throughout the course of the entire process and your fertility journey. So this was a perfect question to remind us all about that again. So thank you so much, Wanda. It does look like as of right now, we are all caught up with questions. So as always, let's give another 30 seconds or so in case there's a question. I'll throw it back over to you, and then you can kick off the third and final product of the night.
All righty. So thanks, Craig. So with the progesterone, as you saw, that was a little different than the Gonalef. And I know it tends to be one of the products that a lot of patients have the biggest worry about. When I'm actually teaching this product that's starting their cycle, patients are often already asking me about the progesterone. So I do hope that video helped to answer and demystify some of the worry and the questions that you might have had. But the idea is that what I will remind you about the progesterone is that it has its place in your cycle. There will be a start date and there will be an end date. Keep that in mind as you approach your fertility journey and your fertility cycle, because sometimes we tend to, our minds have a little chatter because we heard somebody else's experience with it. I just would want you to know that, your experience isn't what somebody else's experience is with anything. And usually most of the time that you're on that progesterone for the time frame that you are, oftentimes it's because you did have success at the end of that cycle. And that's what we're all here for, is that pregnancy outcome from your cycle. So that's where we get that good feeling. And by then we're almost going to be down and stopping that progesterone, because we're going to be leaving the fertility clinic to go on to our next phase with our OBGYN. So just keep that in mind. I think that's really important. The next product that we are going to go into talking about, which was kind of nice because I did mention it in the progesterone video, it's a product called Cinera. And Cinera is a type of numbing cream patch that can be used for some of these injections to help eliminate the sting. Their little, one of their little brochures here that I have has a little bee on it, and it's, taking the sting out of a needle stick. So that's a nice way to think about this. So Cinera patches are something that you can be talking to your clinic, your nurse and your physician team, if you'd like, if you know that you have some difficulty or some fear over, going forward with your cycle. We don't want anything to get in your way. So this is a nice product to know that it exists. If you have any issues with that, thinking about those shots, or even with some superficial veins going in there and drawing blood, it might be helpful for you with that. So what we will take a look at is, let's take a look at this video about the Cinera patch, and then we'll be on back again here to go over any questions that you might have live. Hi everyone, this video is to give you some instruction for using a numbing patch that's available to you if you have difficulties with having shots administered and you're very concerned, or sometimes some people have a tough time getting their blood drawn. And this can be a useful patch to have your center call into the pharmacy, and the pharmacy will check and see what your coverage is for it. But the idea with the patch is just to give you another option of something that might help you in alleviating any fears about blood draws or medication administration. So this medication is called Cinera. It comes in a box that will look like this. Oops, pardon me. Let me put it the right way. And then there are, I believe, 10 patches in here per box. Each patch is a one-time use. So you don't reuse the product. Once you apply it, kind of think of a Band-Aid. You apply a Band-Aid and it might get soiled after you discard it. So each patch is a one-time usage patch. And so when you are applying this to have either a blood draw, okay, or to an area that might be getting injections, which sometimes for fertility mainly could be the buttock area. Some people might want to apply it for the little areas, shots that are in the belly or the upper thigh. But once you get the okay and you have a prescription that does get called in for you, what you want to know is, make sure that the skin area that you're putting this on is not having any cuts or any abrasions or anything that's an open wound. You want it to be clean skin, but you definitely want to make sure that you have no cuts or abrasions or anything like that on those areas. So you would clean the skin first and foremost. And what you'll see is the patches come in a packet, and you will open up that foil pouch and you'll remove the patch and place it with the foil side up. What you'll find here is there is a little sticky, there's a little sticky area here that I will pull off, and then there's a little a harder plastic area. When this goes on is typically 20 to 30 minutes prior to getting a blood draw or getting a medication administered. So you want to apply it to that area. Careful that you don't touch the area that has, you'll notice that there's some little dots in here where it breathes, the Band-Aid. But once I remove this, like a lot of times even Band-Aids that mine have a little bit of medicated Neosporin already in them or whatever, you don't want to touch that area. So same with this, is that you don't want to touch that area. And then you peel it back and off. And so this is the part that's going to stick to the body. And then just for the sake of my demonstration, what I'll do is I'll grab my mannequin that I have. And if we were going to have her, for her muscle shot, utilize this, we would take the foil side down, not touching it, and apply it 20 to 30 minutes before where she's going to get her injection. And she would leave it on, or she would apply it, I should say. She would apply it to that area, leave it on there for 20 to 30 minutes, and then remove it prior to the injection. When you do go to remove this, what I want you to be careful of again is not touching the inner aspects, that silver part. And so in order for that to be safe for you from animals, from other children or anybody, is your packaging. What's nice is you can just apply it to that packaging and then discard. So save the outer foil pouch to be able to utilize that for discarding your patch safely. So there's a bit of numbing cream, lidocaine, there's a little bit in here. And what those, like I said, those numbing agents can be helpful for some people who maybe really have a potential needle phobia, very concerned about their injections, even, might be a little bit of a difficult blood stick. So this is something that you can always talk and discuss with your fertility clinic, your nurse, your team, and let them know your concerns, because I think all of us would agree that we want you to be able to get through your cycle. We want to do everything we can to empower you to feel comfortable. And so if this is something that is going to help you to make that next step and take that next step to the fertility journey, then we want you to know there's some things out there for you that can help. Thank you again, and best of luck on your journey with your fertility cycle. So that was one of the products that I'm so glad we reviewed that right after the progesterone shot, because it's one of the supportive products that I look at that and think that's a supporting product to help some people that really might need that type of product for their injections or for possibly their blood draws. And so that, again, that's great that it followed the progesterone injection. It's pretty easy to work with, so hopefully the video helped a lot, but I know there could still be some questions. So I know, Craig, if you see anything that anybody has to ask about that one, they certainly can do so.
Sounds good. All right, so we have one coming in that says, how long can I expect the numbness to last after I remove the patch?
I think what we looked at this and checked our packaging with it, I think it's roughly no more than about because you're putting it on for 20 to 30 minutes. So I'm pretty certain that it's no more than about an hour after it's had been taken off that it should start to wear off a little bit for sure. So what you just want to be careful with is, scratching the area or putting that area under too cold of water or too hot of water, something like that. only because you might not be able to, like anything that's numbing. Think of when you go to the dentist, a lot of times they will tell you to refrain from maybe eating for an amount of time because you could accidentally not realize that you're biting on the side of the cheek or the gum. So with anything that's numbing, you'll kind of feel that sensation coming back. And typically, I would say, I think it shows on the literature that it's about maybe an hour from when it's taken off, give or take, that you should start to feel and get that sensation back in that area, but not more than that.
Yes, definitely. And I think that's one of the reasons why we said that 20 to 30 minutes time frame is because you just don't want it to persist for too long afterwards. You're getting that
Exactly.
short-term effect. So that's really, really good to know. And thank you for the reminder in terms of, not putting the area in something like hot or cold, or lean against something hot, to
Mhm.
be aware of that. It's something that can be, you just want to be cognizant of all these things. So
Mhm.
great answer. Let's see. Okay, so this was you talked about the disposal of the product, sticking it onto the packaging, and a question comes in: once I stick it on, do I need to dispose of these in a special trash because of the pain-killing effect?
You're not going to need to dispose of it in a special trash. Regular trash is fine, but certainly it does note on there for the product, they want to say be careful of children and any pets. So what I might suggest is that, just make sure you're not maybe putting it in a waste paper basket that's not closed off. Have it where that trash has a closure to it. Because if it's anything like, I'm sure some of us have little animals in our homes that kind of like to maybe dig into something like that, and you just wouldn't want that to get to that animal really, or even a child. So the idea is certainly put it in regular trash, but hopefully one in which it's either hidden or it has a closure to it, just so that the trash can't easily be taken apart by somebody, a little one or a pet in your home.
Yeah, thank you. And I would say that some people might say that the little one is also the animal that they're worried about in their house getting into things. So, yes,
Mhm.
make sure you take care because they will get into stuff. But that's a great question and good to know. Let's see. Okay, so now we talked actually a little bit alluded to some of the things regarding the amount of time that you leave it on and how long it should work and all that. And so the question comes in, it says, if the injections still hurt, can I use 2 patches or can I leave it on longer, or is either one of those too dangerous?
um, if it still hurts, I mean, I would like to hope that it doesn't, because I think these, from what I've seen and the percentages, I think it's like 95% effective, which is a pretty high percentage. But I guess there could be somebody that maybe has an interference with the medication for whatever reason. And it's not necessarily recommended that you should have to put on 2 patches or that you should have to leave it on longer. But the studies also have been done with that. And that does show that it isn't any more detrimental if that were to be the case. So the recommendation is typically 20 to 30 minutes beforehand, applying 1 patch. But the idea is that if somebody did put on 2 or left it on, more probably would be that it could be have left been on a little bit longer. That's not going to be harmful to you because it's going to deliver what it needs to, and it's still going to be where once you remove it, it's the numbingness is going to wear away. So, and that should be about an hour or so after. But again, you want to always follow packaging recommendations. There's a reason for that because the product maker has done some studies on such. So the idea is that you would want to follow what the scenario manufacturer is letting you know, because they've looked at the study that maximizes then its effects. So no, I don't think you should need to apply a second patch or leave it on longer. But sometimes somebody could forget and have left it on longer and then think, oh my goodness, did I really do something detrimental? They did study that as well, though, if you left it on, or even if you did put on 2. And the idea is that it's not as detrimental, even though they still have recommendations on the package insert for you to not do, not have to do that.
That's a great point. I think, you want to treat it just like any other medication, right? And that self-administration and self-medication is never a good idea. When you're told a certain way to take your medicine, just like anything else, you wouldn't just say, let's try 3 instead of 2 because it works pretty well. Like that's not a great move. And this, even though it is a patch, sometimes we tend to think of it a little bit differently, but it is still medication. So yeah, I definitely would agree from the point of view that you definitely don't want to intend to try to use it in a way that's not written on the package insert. But it is good to also know, to Wanda's point, that it has been tested to make sure that it's still safe. So if you do forget to take it off, you leave it on for too long, and then you're worried about that, you can know that at least you will be safe. But that is a great point to kind of look at those two things as very different: the accidental mistake versus the intention to try to use a medication in a way that it's not designed to be used.
Mm-hmm.
So great answer. And with that, right now, a question just came in that I can actually answer some of it, and then Wanda, if I miss anything, feel free to jump in as well from your point of view. It's a little bit more of a general question from the audience about what the program really is. And the question just comes in, just general question. I was wondering, do you guys review the same medications each week during the program or different ones? And that's a great question. And we do, in fact, actually rotate through a bunch of different products, and we're actually bringing new products into the program as well. So one of the things that we always recommend, if you don't hear about a product or you want to hear more about a product, it's always a great place to put a comment right on the Facebook page and let us know, because we actually came up with a couple of new products to add into the rotation because of questions from patients out there listening, such as yourself. So we did actually also start just recently. We started adding in the name of the program itself what products we're talking about. So when you pop it open and you look at it, you can see right in the description the products that we are about to talk about that night. And then when you go and look at the on-demand version of it, you can see the 3 products that we referred to as well. You can always go in and just look at the individual products themselves. So if you didn't want to watch the full PharmAssist VLE, you can just watch those individual products, and they are all broken out obviously by name of the product. But if you wanted to watch the full thing, you can see exactly what we did talk about, so you can make sure you get the best bang for your buck and your time. But yes, we do rotate through. And if you think of anything else you'd like us to talk about, we'd love to hear your ideas. You can let us know right at the mymandelsPharmacy.com/PharmAssist page, or right on this Facebook page if you're watching it there. So anything that I missed, or anything else that you wanted to add, Wanda?
I would just say that I would encourage them, to also, I know it's all about the medications, but I do think going back to prior episodes of the live events is wonderful, because each nurse around the country that Mandel's has as a part of this program provides their different way of teaching, and maybe the questions that they get and receive. So we're all kind of collaborating as fellow nurses in the field to bring to the table all that we can with our years of experience, and we all have different experiences with our patients from different clinics. So again, it's great to look at the medications, and absolutely I think that's very important, but I would encourage you to peruse through a little bit of the live events, because you'll see that there's a little more to that, and I think it does showcase the practitioners a lot, giving their little tips and hints that make it special that Mandel's has brought us on board to use our skills and our backgrounds to really bring another way to get to you all through the virtual learning experience.
Could not say it any better. So thank you so much, Wanda. That was awesome. And with that all being said, it does look like we have gotten through all of our questions. So what I'll do is, again, another 30 seconds or so in case you have questions. Now it's kind of open up to everything. So whether it was a general question like we just got, if it's a question about one of the 3 products, or even separately outside, maybe a different product, if you just have a question while you have Wanda here, it's a perfect time to ask. So I will throw it back over to you, Wanda, if there's anything else you wanted to share with everyone while we give them some time to get those last few questions in, and then we can begin to wrap up for the evening.
Perfect. As Craig said, there is something I do want to share, and what I try to do in my little snippets here with the virtual learning experience is I am also a certified healing touch practitioner, which deals with energy medicine. So I always like to look at giving and thinking about something for these events that I can share that hopefully is something you haven't thought about or you didn't know what to do. But I think it's really important to know that self-care during these cycles is really important, and it's not being selfish to practice good self-care. Something I came upon in my energy magazine today, actually I was looking at it, was the word forest bathing in quotes. So I would to not take up too much time here this evening to get in very in depth about it, but it's about us connecting with nature. And it really stated that, you know, some of us were dealing with a nature deficit disorder, and COVID really brought us looking for ways to connect to nature. And I can only say from my own personal standpoint, when lockdown was here, I was searching for every different park that I could go to when things were locked down. I think I was instinctually looking for something to connect. And I thought one of the ways that they talked about this was that we live in a world where we focus more attention and effort on recharging our phones. And our smartphones are only as smart as they can be when they are plugged into an energy source regularly. So what I would have you think of is you're smart, and we are much smarter when we are plugged in to an energy source on a regular basis. So with it approaching a new month and longer days and some nice weather, I know it's been a little tricky with wind and things that have been whirling around out there today and yesterday, but last night, but just want to let you know that, you know, it's time to bring ourselves maybe back to nature. So do what you can to maybe incorporate a little bit of that in your cycle. If you're working from home, maybe put your you know, your laptop outside and maybe spend a few minutes doing your work from home outside. You're getting your work done, but you're exposing yourself to some of that vitamin D and all of that. If you have the opportunity after work, after being hooked into your computer, you know I have been going to my job since June. So I've been somebody that I find when I'm in the office, I go home and I try to get a little bit of the outdoors. So I just really want you to know that I think it's big important for our mental well-being, physical well-being, and there's a lot out there in nature. So look up a little bit about forest bathing. It's about just connecting yourself back to nature. And I really think it's one good little tip to do for yourself throughout these cycles. Get yourself out there when you can, because that's going to help break up a little bit of what you see as a perceived stressor, which is your fertility cycle. Okay. So a little reminder is I am very thankful that you had me here this evening, to Mandel's Pharmacy and to all of you for signing in to the virtual learning experience. Know that these learning experiences are live every Monday night at 7 p.m. It won't be me every night. It'll be somebody else new that's here. And that's the great part of it. Also, that you can go to mymandels.com/PharmAssist and look at those videos for each of the medications, some of the other products that weren't showcased tonight. And you can also look at some of the previous recordings of the live events. And like I said, that's a real great way to hear from other nurses that might share their expertise and knowledge as well. But as always, it was great to share the evening with all of you and with Craig for his great abilities to help put this all together as well.
Thank you so much, Wanda. I appreciate it. We all appreciate it at Mandel's. And thank you so much for your time and your expertise and all that you bring to this program. We really would be nothing without you. So we appreciate that. And then thank you, obviously, to everyone from home who joined us, whether from Zoom or from Facebook Live. All those excellent questions that you guys brought to the table. We hope you were able to learn a little something tonight, and that maybe this will be an impetus to hop back on another program or check out some of our other videos that we do have. And speaking of which, they tell us that repetition leads to retention. So I will say it one more time, what Wanda just said. Do not forget that all the full virtual learning experience videos, or VLEs as we call them, as well as the individual product demonstration videos, they're all available on demand. You can find them on our YouTube page, on our Facebook page, where you may be watching this right now, and then obviously back at our homepage, mymandelspharmacy.com/PharmAssist. There's actually some other videos there as well. We are adding in some behind the shots stories where our nurses that are involved in the program talk about their stories behind the shots, why they got involved in fertility in the first place. We have a lot more coming to the PharmAssist program, so keep checking out that website. Bookmark it. You'll be able to go in and see a lot of the different things that we're doing. The sharing, Leaning on Sunshine, where we share pictures of different programs that we do with our nurses to support you at home. So when you have sometimes those days where it's gloomy out and you just want to take a look at something that can brighten your day, Leaning on Sunshine is a perfect place for that. So we do look forward to seeing you all here again next Monday night at 7 p.m. Eastern Standard. As always, I just want to say that if you thought this program was great, please, please, please share this with someone. Share it with a friend, a family member, a colleague, anybody that you think that could benefit from hearing about this program, just as you did. Please let them know about it. It's the #1 way that the information is going to get out there. So as always, we just want to thank everybody for being a part of the PharmAssist program. We look forward to seeing you again next week, and there'll be another great speaker, special guest next week as well. Thank you again so much, Wanda, for all your time and your brilliance tonight. We appreciate it, and we will see you all again in a week. Have a
Have a
great
good
day.
night.
Bye-bye.
Thanks.